recruitment of healthcare facilities. NHIS has gone further to develop ENHIS. This infrastructure developed by NATCOMSAT and its partners will completely automate the health insurance business process in the country. In few weeks to come, in few weeks ahead, the Honorable Minister of Health, Dr. Emmanuel Ihanere, will invite Mr. President to launch this game-changing project. In order to ensure no one is left behind within the health insurance space, a new innovative program known as Group, Individual and Family Social Health Program, GiftShip, has been developed and launched. GiftShip is designed to bring the informal sector groups into health insurance ecosystem. In line with this, individuals, families, groups, associations, philanthropists, as well as Nigerians in diaspora can have opportunity to contribute and benefit from the program. Awareness drive for this program has been intensified through the use of the traditional and social media platforms. We therefore urge you, the media, to assist in taking the message of GiftShip to the home of every Nigerian. Usually at the occasions like this, one recurring question that is usually asked is what is the total number of people that are currently covered under the health insurance. In answering this question, it is important to state that health insurance is not a free health arrangement. It must be paid for. Therefore, the total number of people covered represents the total number of people that are paid or have been paid for. More so, the health insurance in Nigeria is a decentralized system, and as such, every state has its own health insurance agency. It is important to observe that most of the states are currently enrolling staff of public sector in addition to implementation of the basic healthcare provision fund for the vulnerable segment of their populations. Therefore, the total number of Nigerians that are currently covered can only be obtained when a summation or aggregation of these figures is done. To effectively coordinate the entire health insurance ecosystem, the National Health Insurance Scheme has established an innovative platform known as Health Insurance Under Our Roof. This platform will aggregate the effort of all health insurance stakeholders, leveraging on the ENHIS as a common monitoring and evaluation framework to achieve the common goal of universal health coverage. Furthermore, the National Health Act, which provides for the implementation of basic healthcare provision fund, is a significant opportunity for providing access to quality healthcare for the vulnerable populations. NHIS as an implementing agency of the fund has so far disbursed over 14 billion naira to all the states, to all the benefiting states, for the benefit of the vulnerable populations. Another initiative developed by the National Health Insurance Scheme, which is worthy of note, is the NHIS Medicine Supply Initiative. This initiative is designed to address the lingering problem of out of stock, as well as incessant complaint of substandard drugs by the enrollees. Under this arrangement, drug manufacturers will manufacture NHIS branded drugs at a cheaper rate, therefore addressing the issues of availability, accessibility, affordability, and quality drugs for our teeming economies. Some days ago, we published an expression of interest for pharmaceutical manufacturers of drug and drug management organizations to participate in the NHIS Medicine Supply Initiative. May I also add that the NHIS Lodge Sharing Initiative has been unveiled in 6 tertiary hospitals around the country. With this initiative, cancer drugs will now be highly subsidized. In the areas of capacity building, NHIS has trained over 425 staff in ICT through our collaboration with Digital Bridge Institute. NHIS has also trained a total number of 927 staff across its headquarters, zonal offices, state offices in the new business process that has been developed. Recently, the scheme unveiled the NHIS Leadership Program, NLDP, which is being implemented with the support of development partners, R4D, and all the general managers in the scheme have been trained, and the training will soon be extended to NHIS state coordinators and chief executive officers of the state health insurance agencies. Earlier on, I mentioned that all the presidential action points have been achieved except one. The remaining one, which is in progress, is a review of the National Health Law to make health insurance mandatory for all citizens. You will observe that this very directive is not within our control. Nonetheless, we are confident that the proposed amendment will receive presidential assent. The significance of mandatory health insurance is underscored by the fact that it holds the key to universal health coverage attainment. We are very optimistic that if all these initiatives are properly and judiciously implemented, it will fast-track the attainment of universal health coverage by the year 2030 in Nigeria. In the meantime, we are not resting our oars while we acknowledge this short-term achievements. We have collectively pledged that we will continue to work until NHIS becomes the pride of all Nigerians. In conclusion, I want to express my sincere gratitude to Mr. President for finding me worthy to spearhead this onerous task of reforming and transforming this organization. I will also wish to sincerely appreciate the Honorable Minister of Health, Dr. Osagi Emmanuel Ehanire, as well as the Honorable Minister of State for Health, Senator Dr. Olurunbi B.A. Mamora, for their unflinching support and guidance towards the ongoing reform in the National Health Insurance Scheme. I especially thank the members of the National Assembly, the Senate Committee on Health, the House Committee on Health Services for their numerous support, especially in the process of amendment of the NHIS bill. I appreciate our sister agencies under the Federal Ministry of Health and other ministries, departments, and agencies for the numerous development partners who have been supporting us. The State Social Health Insurance Scheme, the health maintenance organizations, the health care providers, and all our numerous enrollees nationwide. I sincerely thank the management of all the management staff of NHIS for their support over the past 1.5 years. Together we are making history, but there is a lot more to be done. Last but not the least, my special thanks goes to the members of the 4th Estate of Real, who have continued to support us to increase the level of awareness about health insurance and NHIS in Nigeria. Thank you, and God bless you all.
Please, can we appreciate the Executive Secretary? Thank you so much. Please, if there are questions, and we imagine there would be, the Executive Secretary will field questions where you think that you didn't quite understand it. So please, if you have any questions, can you kindly step forward? I'll yield the microphone to you, then you ask. But if you do not have, are there any questions?
I think it will be better to have a speech so that if we are asking.
Okay, we are going to. Okay, please, please can you circulate the speech now? Yes, you can have the speech right away. Yes. Thank you so much. You can have the speech. All right. Thank you. But from the beat you heard, do you have any questions? In any event, the Executive Secretary mentioned 3 items, 3 major items we would, because of this program, the ENHIS, the Medicine Supply Initiative, and the Group Individual Family Social Health Insurance Program. Very brief presentations of them so that we report it from the context of knowledge. The Executive Secretary will also have this privilege to hold a meet and greet with members of the 4th Estate of the Realm. They are here. He would want to meet with you personally, chat with you. So we have a meet and greet, and thereafter a group photograph. All right. Okay. Other questions now? Okay. Please. Okay. I'm here. Okay, you have a question. Yes, sir.
All right, yes, sir. Good morning, sir. My name is Friday. I work for Channel TV. I was trying to get the exact place we're mentioning about 14 billion disbursed, but I think this is on page 7. I just followed from it. I'm seeing some figures on page 7. I'm sure it is. Okay, page 7. You talked about 14 billion disbursed from the basic health provision fund to state. I'd like to know, do you have a mechanism for tracking so that the funds that are disbursed to these states are not just do not just go into wrong hands, but they achieve the actual purpose for which they were disbursed? If you do have a tracking mechanism, I'd like you to talk to us briefly about that tracking mechanism. You talked about what the scheme did to address some of the challenges on page 5. And you talked about the bullet points B and C. You talked about the delay in payment of providers. That's a big problem. You also talked about the denial of service to enrollees. Of course, I am one of those who have suffered from that, from those HMOs also. I do not have trust in them anymore. So it's a big problem that a lot of persons do. I'd like you to give us more insight to it. Have you paid HMO who maybe breached any of your regulations? If you have penalized any HMO for not meeting up in the last few years, last few months, it will make news for us. So tell us how many HMOs have you penalized for not meeting up with the terms of contract in order for you to strengthen, or you have another way you use in strengthening that weak point in the chain. I think I would like you to respond to those two questions first, sir. Thank you so much.
Good morning, sir. My own question is on cancer drugs. Can you please explain more? Okay, my name is Moduwe Ajuloju, Captain FM Abuja. Can you please explain more about the cancer drugs? Is it all the cancer drugs that will subsidize? And what are we to expect on this? Thank you.
Do we have any more questions so that the ES can take all of them at the same time? No more? Okay. Okay, you have a question.
Good morning, sir. My name is Bashir Idris Abubakar. I represent Jarida Radio. So I would like to know what you're doing to address the problem of people in someone pay for them and how can they benefit from the service.
Any more questions?
Good morning, sir. My name is Nancy from Radio Nigeria. This is more of a practical question I would like to ask. You spoke about the changes you have made in NHIS since your resumption. I want to ask, how do you get to address the bureaucracy in registry, in your office when it comes to registering new members or coming as a new participant? It's like when you get there in the morning, at day. So even if you come at 12:31, they tell you to go and come back the next day. And this has happened more than 3 times. I've been there to investigate myself. Thank you.
Any more questions, please? The ES is here. You don't climb the Roko tree twice, it's just once. So ask all your questions, please. All right. Any? Okay. Who? All right. Thank you. So I think that will be all.
Thank you very much. The first question was about disbursing 14 billion naira from the NHS gateway to the states, whether we have a tracking mechanism. Before the disbursement, in fact, before the final document for the Basic Health Care Provision Fund was concluded, there was what is called a guideline for implementation. And within that guideline for implementation, there is clearly defined monitoring mechanism and monitoring and tracking mechanism to ensure that every kobo that has been disbursed is tracked. There is also governance structure, multi-layer governance structure that will ensure adherence to all these arrangements. At the level of Federal Ministry of Health, there is what is called Ministerial Oversight Committee, which ensure that monies that are meant for Basic Healthcare Provision Fund are disbursed to all the gateways, and they also go ahead to even monitor and track whatever gateways have done. When I talk about gateways, I'm talking about 3 major gateways for the Basic Healthcare Provision Fund. The NPSCDA, Primary Healthcare Development Agency, the National Health Insurance Scheme Gateway, and the Emergency Medical Services Gateway. So that is encapsulated the guideline for implementation. Another thing that we do at the level of NHIS, we invited a non-governmental organization, international partner, who has excelled in the area of accountability and transparency to help us to develop what we call accountability framework, so as to be able to track all the funds that we have disbursed to the states and healthcare facilities. That process has been developed. Our staff have been trained at the state and at the state level, so that they can implement all those keys and tools in ensure tracking of the funds. We have a case in one of the states whereby our state office confirmed to us some of the funds that were supposed to go into the National Health Insurance Gateway have been utilized in what is called supply side aspect. And we have swung into action to bring that state to book and ensure that those funds that have been moved for the purchase of some equipment as opposed to purchase of services by the enrollees are retrieved. So we have a very effective monitoring and evaluation and tracking mechanism for all the funds. And from time to time, for example, in 3 major states which are being supported by the World Bank, they complement the tracking mechanism of the funds that we have disbursed. Number 2, the question number 2, whether we have been able to penalize any REHMOs when we say that we have put in mechanism for addressing operational lapses. It is on record that 1 year after my assumption of office, I delisted 10 HMOs who have not been able to fulfill the mandate as enshrined in the guideline of the National Health Insurance Scheme. In fact, this has been a major news item within the National Health Insurance ecosystem. For the first time in 20 years of existence of National Health Insurance Scheme, 10 HMOs were delisted. Those HMOs have gone to heaven and earth to ensure that this punitive measures is reversed, but we stood our ground very firmly. And this, the improvement that we see in terms of meeting obligation of the healthcare providers is not unconnected with that wild stick, that hammer that we use. And ever since we wielded that hammer, the HMOs are fast gravitating towards making their organization to be efficient. It is a long time decay. We cannot see the result in a year or 2. But I can assure you, we are doing all that it is necessary to address these problems. And when we undertake our accreditation exercise, it is usually every 2 years. Any HMO that we also find not to be meeting the obligation will be delisted, and nobody can really ask us to revise, because we have a clear mandate to go and restore confidence in the delivery of the National Health Insurance Scheme. The third question was on cancer drugs. Is this the case? What do we expect? There are multi-front approach here. We have an overarching arrangement with drug manufacturers, as I mentioned in my speech, that we are going to be branding drugs, selected drugs within the National Health Insurance ecosystem so as to address the lingering problem of drug supply within the National Health Insurance Scheme. So within that overarching framework, we expect we are discussing with this a lot of pharmaceutical companies who have indicated their desire to also brand drugs for the National Health Insurance Scheme. The Roche, which is a very well-known pharmaceutical company, did not even wait to come into collaboration with the National Health Insurance Scheme to say that they want to quickly start manufacturing drugs for cancer, and they are ready to give about 50%, 30%, 50% subsidy for the National Health Insurance Scheme. That is to say, if a drug is 100,000 naira, Roche will be able to sell it to the National Health Insurance enrollee at the cost of 50,000. And the National Health Insurance Scheme will pay 30% of that cost. Then the patient will only pay only 20% of that cost. This is unprecedented in the annals of the healthcare delivery system in Nigeria. The next question, how can rural communities benefit from the National Health Insurance Scheme? This is a very good question, because unless if this question is addressed, there is no way we can achieve universal health coverage. If you have listened to my speech very clearly, you will hear when I say that health insurance is now a decentralized system. The national is there, the states are there. The state health insurance agencies are responsible for covering all the formal sector at the state and local government level. So by that program, that formal sector program, they will be able to cover teeming population at the local government level. And I mentioned the fact that federal government has disbursed money to the state. This money that has been disbursed, the 14 billion naira, is supposed to go to rural communities and identify the vulnerable segment of the population and be covered. And this fund is coming from the consolidated revenue of the federal government as it is own contribution toward the coverage of the vulnerable population. And I can tell you, a lot of rural community members are now benefiting from that initiative. Although the amount of money that is dedicated for the program will not be able to cover the entire vulnerable communities, which are more populated at the rural community level. But this is an initiation. And I believe that by the time you help us to market the gift ship program, which we have launched, a program that is supposed to cover informal sector, it has a provision or an inbuilt mechanism whereby adoption can be made. By adoption, I mean that a rich person in the urban community can adopt some community at the rural community and enroll them into the National Health Insurance Scheme. That can deepen the penetration of the basic healthcare provision fund or vulnerable segment of the population health insurance. In addition, we are also embarking on other innovative financing mechanisms. In our proposal for the amendment of the Bill of National Health Insurance Scheme, we suggested that 1 kobo per second call, if you make a phone call and 1 kobo is deducted for every second call, it can bring about billions of naira into the National Health Insurance Fund, which can be used in subsidizing healthcare for the rural community. Although this proposal had been opposed by people within the financial sector, but we are still dialoguing with the National Assembly and top policymakers to see how other innovative financing can be factored into aggregating funds that will cover the vulnerable segment of the population who are mostly residing in the rural areas. The last question is, how do you address the bureaucracy in the enrollment system? The contributor has alluded to the fact that she has visited NHIS severally to get this done, but she had a lot of frustration. We have embarked on many initiatives that will enable us to be very responsive in doing our business. One of the things that we have done is to try to decentralize the NHIS activities. We have been able to employ relevant staff, and we have embedded them in every state, and we have been able to strengthen those states to be able to perform the stewardship role. NHIS is not only operating within Abuja, but other communities or other states in the country. But it will surprise anybody that up to the time when I came as a CEO of the National Health Insurance Scheme, NHIS was operating a manual system in the 21st century. A system that an enrollee, if he comes in, he will have to fill in forms, and those forms, even if they are not within the headquarters, the forms will have to be transported to the headquarters where entry will be done, and when the entry will be done, in the process, some of the forms will be missing, and so on and so forth. Then one of the key resolutions when I came to NHIS is how do we comprehensively automate the entire health insurance business process. And that is where I mentioned that we have now developed a state-of-the-art infrastructure for the automation of the National Health Insurance Scheme. And the length and short of this automation process, it will reach a level in some few months to come whereby somebody who is willing to get National Health Insurance Scheme can use his application, smartphone, and register and get and do whatever he wants to do within a twinkle of an eye. This is the level that we have taken the National Health Insurance Scheme, and this is the final answer to all those operational bottlenecks. That was all the questions that have been asked. Thank you very much.
Thank you, sir. Do we still have more questions? Okay, last. Okay, ma'am.
It's still ma'am from Radio Nigeria, sir. Thank you for answering our questions, but I feel my question has really not been answered. I'm not even referring at the state levels because those areas do not have problems. I'm referring in the FCT here. When you go in the morning, they ask you to come very early. You leave your location as far as, say for instance, Airport Road, and you come as early as 7 a.m. You're asked to sit outside and wait. Now, they do not resume even at 9. The queue keeps piling, and then they give you number for only 30 people. To attend to only 30 people regardless of where you're coming from. And then once it's 1 p.m., they are shut for the day, even when they did not start early. Once it's 1, they close and tell you to go to wherever you're coming from and come back just to add a beneficiary. Then lastly, I would like to appreciate the CARTA initiative. It's a very, very welcome development. But I would like you to throw more light on the 6 tertiary institutions where it was unveiled. Thank you.
Can I ask you a question? We have 2 registration centers in Abuja. Which one are you?
The one in Wuse 2, the annex.
Okay.
Thank you.
Ideally, Wuse 2 is not supposed to be a registration center for FCT. The registration center for FCT is supposed to be in Zone 4. That is Zone 3. That is our FCT office. But because at the initial stage of NHIS, everything is being done at the headquarters, that was why we retained it. But largely, we have moved our operation of FCT to FCT office, which is in Zone 3. But even if we have not moved the operation to that place, the final answer to engendering efficiency is automation, which I have told you that we have invested so much in automating the process, in so much as people will have to come to our office and be asked questions to enroll. It will be determined by efficiency. We are looking at the final solution. The final solution is the automation, which I have told you we have invested so much, and we are awaiting the launch of that system by the Honorable Minister or the President, because this is one of the major national critical assets that we have developed within the NHI system. And if this group will want to tour what we have developed, we can have an opportunity to go and tour it. We have developed an infrastructure that will not only, that has the capacity to take all the data of West Africa, health data in West Africa. That is the level we have taken the NHIS. Let's exercise patience. Let us have information so that we can continue to do to get things right. Your last question has to do with where are the institutions that we are partnering with Roche. I told you there are 6 or 7. 6. In fact, 1 has been added. The National Hospital has been added to make it 7. 1 is UCH Ibadan. Number 2 is UNTH Enugu. Number 3 is Federal Medical Center Gombe. Number 4 is UBTH Benin. Number 5 is ABU Teaching Hospital Zaria. Number 6 is Aminu Kano Teaching Hospital. And finally, the National Hospital Abuja. These are the current facilities where we are pilot testing the Roche NHIS initiative for cancer treatment. Thank you very much.
I have another question, sir. Modupe Adiloju, Captain FM again. My question is on number 14. You said, what is the number of people, Nigerians covered by NHIS? I think data is very, very important, and I think for planning, this issue should be addressed so that we can have the total number of Nigerians on NHIS presently to know whether there is improvement or there is, people are less on NHIS scale. Thank you, sir.
Okay. I can tell you without any fear of contradiction, even if I don't give you an absolute number, that there has been a tremendous improvement in the National Health Insurance Scheme in the last 2 years. Number 1, when we came in, NNPC was not part of the arrangement of health insurance arrangement. The entire NNPC has come in. Number 2, when we came, there was a serious problem with police and so on and so forth. We stabilized, and the police have continued to enjoy services. When we came in, there was no single retiree that is coming to the National Health Insurance Scheme. We have now been able to bring retirees from, first and foremost, forces. Police retirees are now being covered, military retirees are now being covered, DSS retirees are now being covered, and the Minister of Health has inaugurated a committee that is working on the retirees in of the public sector. The committee is working, and they are going to make a proposal to the government. Number 3, when we came in, NYSC are told they are not part of the National Health Insurance Scheme. But I am telling you that Now we have increased the enrollment rate of the NYC into the platform of the National Health Insurance Scheme to the tune of 360,000 corps members every year. The program is working. When we came in, associations were not coming. And I can tell you that Nigerian Bar Association, as enlightened as they are, they have now subscribed and their members to join the National Health Insurance Scheme. When we came in, when I came in, none of the state was implementing the Basic Healthcare Provision Fund. But now, 36 states and FCT are currently enrolling thousands and thousands of people into the Basic Healthcare Provision Fund. So I think you will agree with me that NHIS is in upward trajectory. The reason why we are defining giving absolute figure with the deployment of our ENHIS, there will be a comprehensive integration with all the states and all the stakeholders, where data will be channeled into the National Health Insurance Scheme seamlessly. But as I'm talking to you, if you go to our platform now, as I'm closing my mouth, you will see additional life coming to the National Health Insurance Scheme. Thank you very much.
Thank you very much, sir. And we want to thank you for all your questions. I think we'll draw the curtain on the questions at that. And so we'll, at this point, take the next item with the Executive Secretary. You'll have the privilege of meeting the Executive Secretary one-on-one. So I want to invite my boss, the General Manager, SDO. He's a media man. He knows everyone in the room, all the media persons. So he will lead the Executive Secretary to meet with each of the correspondents. So they are putting on their name tags, so you meet them so that next time they'll have easy access to you, sir. Mr. Yosinu, sir. Then thereafter we'll have a group photograph. Then we shall bring the first part of the program to a close. Thank you, sir.
Thank you very much, sir. The Executive Secretary, sir. The revolution that we have inspired and led in NHIs has not been limited to the operations and management of the scheme. It also includes the communication infrastructure of NHIs. And today, I'm very proud to acknowledge, sir, that NHIs has the fastest growing media team in West Africa. And that is an extension of the spirit of reform, sir, that you brought to the house. Over time, sir, the functions and features of the media has been classified successfully into two. One is to gather and report the news. The other is to interrogate activities and results from various organs that manage society. On that premise, we have that the media essentially becomes the watchdog of the public. So they watch the executive, they watch the legislature, they watch the judiciary. Therefore, because of that status and that expectation, the media itself has been classified as the fourth estate, ranking only behind the executive, the legislature, and the judiciary in the management of modern society as we pursue the advancement of the conditions of mankind. And in NHI, sir, boldly we can assure you that the Nigerian media has always been very favorably disposed to the scheme as an institution and our operations. So today, a cross-section of the Nigerian media is here, as usual, friendly and attentive to NHIs. And we would like to please invite you, sir, to please meet them one by one. Please let me invite you to please come forward so that we can do this before the cameras. Please. Please take them. Yes. What does Friday want?
He wants a presidential handshake.
That's what we're here. That's why we have this arrangement. So, thank you, sir. Please just introduce yourself, your names, your meeting.
Friday O'Connor from Channel TV.
Thanks, Friday. Udupe has reported health, sir, for not less than 18 years. Okay. Wazobia FM.
Nancy, Radio Nigeria.
Who has been a friend of the house for nearly 2 decades as well.
Ishoma Apiaiwa with Hot FM. Yes, sir. Thank you, sir.
Hot FM sir has been remarkable in their support for NHS over several years.
News agency of
Land is our friend.
It's better, we have to give it better.
New age, I'll never get old, we are new every day.
My name is Lizzie. I report for the ATM.
This is in front of the house.
Solomon Indahi from Kule.
So we have the Hot FM, we have the Cool FM, we have other friends. So we are safe, sir. Thank you very much, sir.
Thank you, sir. Thank you so much. Please, we will now have a group photograph with the Executive Secretary. Please, let's step forward. We'll have it here. The Executive Secretary, please. Let's come over. We'll have a group photograph. Please. Okay. Go behind you. Please come over, please. Let's have this group photograph with the members of management and correspondent as well. Please. Don't be scared. The Executive Secretary is very friendly. You're scared. I don't know why.
Only with press first. Okay, I'll slap it. Another one. Then the GMs.
Yeah, the GMs can join now. Please, you can still let the GMs join them now. Thank you very much indeed. Thank you, Secretary sir. We can bring this, the part 1 to a close and go for tea break, please. Okay, please, all those members of media and public relations unit, Let's take a shot with the executive secretary, please. Come with you're wearing the uniform. Please. Please, can you quickly? Please, may have a team. Please, let's go for the tea break. We may not have the second session because the correspondents are all left. They're all left.